Namaskar. Myself Dr. Jitendra Nath Patnaik. I am the cardiothoracic surgeon of AMRA Hospital, Bhubaneswar. Every year in 29th of September, we actually observe as or celebrate as World Heart Day. As we know, heart is a very important organ of the body because it's the only organ which keeps on working throughout life, like from birth to death. It doesn't get rest. Anybody, all of you can understand. If heart takes rest, that means what happens? It means heart stops, means life stops. So to make it, keep it healthier, to keep it safe, it becomes much more important, much more prudent how to take care of it. And as all of you know, we are passing through a very unprecedented times because of this COVID pandemic. And as you know, COVID is a organism which is going to affect all the organs, like from, as many of us thinks that it only affects the lungs. No, it affects the brain, it affects the heart. In fact, there are many deaths which are not proven, but there are so many deaths that occurring because of coronary artery thrombosis. As the virus causes thrombosis in the cerebral veins also, there is sudden deaths because of brain stroke. There is, as many of us knows, that there is heart stroke or there is a heart attack, myocardial infarction because of this thrombosis in coronary arteries. And this may be due to COVID also. So this year it becomes much more important and the organ becomes much more special, so that we have to take much more care of this organ. So the theme of this year, World Heart Day, is to use your heart to beat cardiovascular diseases. As all we know that what are the risk factors of heart, that is, one is your excessive smoking, high blood pressure, the hypertension, diabetes, bad lifestyle like sleeplessness, excessive stress, and dietary habits like using junk foods, excessive fatty food, fast foods. So these are the things we know that these are the most causative factor of most of the heart diseases. So we have to keep your heart very safe and healthy, particularly to tide over this unprecedented time. If the coronary artery is diseased already, so there is a more probability that we might, if there is infection due to COVID, our cardiac or heart may be develop thrombosis in the coronary arteries leading to any heart attack or anything. So what are the things we should do to prevent such a catastrophic scenario? Like, as we know, regular exercise like yoga and aerobic exercise, and avoiding smoking, excessive alcohol, and avoiding fatty foods, avoiding junk foods, and if possible, as we all know, because there are so many things, we are losing our near and dears and we are losing our jobs. So many things are happening financially, economically, and mentally also because of the COVID pandemic. So what happens, there is a lot of stress now. So because of stress also, stress has a very bad effect on cardiovascular system or heart. So as far as possible, if we can avoid stress, and this, how can we avoid stress? By keeping ourselves happy, keeping ourselves healthy, by doing some exercises, diverting our attention towards exercise, diverting our attention from COVID to other things like, if possible, if we get time, do some swimming, whoever can swim, and some type of outdoor games are not allowed, so alone we can go for a jogging, or you can do yoga in the house. And as there are not much of physical activity because many people are working from home, so life has become very sedentary now. Lifestyle has become bad, no exercise. So we need to regulate our food habits also, like as far as possible, less fatty food, less junk food, less fast food which are containing much of high calorie, high cholesterol diets. So these are the certain things we need to address this time, as heart is one of the organ, we can say, I will say that there are certain organs which God has given in duplicate, I mean double in number. You can say we have got 2 eyes, 2 kidneys, liver has got 2 parts. So there are so many things. Brain has got 2 halves, in the brain is divided into 2 halves. 2 halves has got different roles. So we have testicles too, as in males, and 2 ovaries. So there are so many organs in the body which contains, or there are 2 in number. So by any chance, if one gets diseased or gets affected by some kind of disease, the other takes over and your life can go on. But as you know, heart is a single organ and it doesn't get rest from birth to death. Heart cannot take rest. It only can slow down when we rest. So we need to give some kind of rest to him by keeping ourselves cool. As you know, when we are stressed out or when we are anxious, our heart rate goes up, heart rate becomes fast, there's a little more work load on the heart, so heart gets weaker. So we need to keep our heart rate under control. How can we keep it? By doing exercise, by keeping ourselves calm, quiet, doing some yoga. So these are the certain things we should address at this point of time. As we know, we are passing through a very bad times, unprecedented time. And since I am from Bhubaneswar, and as we know, I think our state is passing through or going through the peak stage of COVID, and we are having enough number of cases in all the districts of the Odisha, and we are having a lot of COVID patients. So we need to be more careful, not only preventing our heart from some cardiac diseases also. We keep ourselves protected from COVID. How can we keep ourselves protected? I am seeing patients in the OPD. There are almost more than 90% people, they have not understood what is the use of mask now. They keep their mask below nose or below their mouth, hanging around in the chin. So what happens now, many people think, yeah, I am wearing a mask, but that is not going to help, because your nose and mouth has to be covered anytime. Otherwise the virus can go in through the nose or mouth, it can infect you. So this is the mask is very inherent now and very real absolute necessity now. Other thing is sanitation, using your hands and maintaining social distancing, which is not, I think many people is not believing that, because if you go to market, you see so many people are clumsy around and doing marketing and all. So it's my request. So this is a kind of war scenario now. We need to keep ourselves healthy and keep our family healthy. It's just like a war. When you are going to fight a war like a army or you're like a Jawan, you have to keep yourself alive to pass on the war, so that when you come back, you will be called as a winner. Otherwise, you will be called as a Sahid. So it's my finally, I would like to say, I give a message to everybody like that. Okay, this is a different time. So this time, heart becomes more special, as I have elaborated the causes why heart is more special. All organs are inherent in and interdependent with each other, but heart is as a special organ. So you need to take care of yourself, and how and why I have already explained. So I hope and wishing all of you to take care, stay safe and stay alive. Thank you.